Good afternoon, everyone, and welcome back to our new season of Ask Her webinars. I'm Sarah Weatherby, Director of Communications at Washington Area Women's Foundation, and we are excited to have you join us for what promises to be an insightful and powerful conversation. The Women's Foundation is a community-supported organization that invests in the power of women and girls of color in the Washington, D.C. region. Through our commitment to grant making and advocacy, we drive transformative change by amplifying the voices and experiences of women and girls of color and collaborate with partners to influence policies and philanthropy focusing on gender and racial equity. As we gather today, I am reminded of the words of Maya Angelou. Each time a woman stands up for herself without knowing it, possibly without claiming it, she stands up for all women. It's in this collective spirit that we come together today to drive meaningful change for women and girls of color in our region. Now, before we dive in, I want to encourage you to feel free to participate in today's conversation by sharing your comments in the chat. If you have questions for our panelists, please submit them using the Q&A function at the bottom of your screen, and we'll make sure to take time at the end of the discussion to address as many of your questions as possible. Lastly, if today's conversation inspires you, we invite you to consider making a gift by visiting thewomensfoundation.org. Your support helps us accelerate progress towards racial and gender equity, giving women the power and resources they need to thrive. Now, without further ado, it is my pleasure to introduce our moderator for today's discussion, Washington Area Women's Foundation board member and the CEO of GlobalGiving, Victoria Vrana. Victoria is a true champion of innovation and philanthropy, currently leading the charge at GlobalGiving, a remarkable organization that connects donors with grassroots projects worldwide. GlobalGiving empowers communities to drive their own change, supporting everything from education and healthcare initiatives to disaster relief and environmental conservation. Their work is a testament to the power of collective action, and we are so fortunate to have Victoria here to guide our conversation today. Victoria, thank you for joining us.
Thank you so much for having me, Sarah. So I think I will take it from here since Sarah just turned into our fabulous logo, and she is still very much with us though. But I am really excited to be here because, as Sarah was saying, the organization I lead is all about community-led change, but so is the Washington Area Women's Foundation, right down to the young women in our community, as you'll hear today. Because Washington Area Women's Foundation believes, as I believe, and as GlobalGiving believes, that the people closest to the challenges have the best solutions, right? And so that's why community-led change is so important. So I'm really excited to introduce our panelists for today. And these are all the fabulous team at Washington Area Women's Foundation who I get to work with as a board member. So it's fun to talk to them in this configuration. First up, we have Abriana Kimbrough, and she does 5,000 things, it feels like, at the foundation. But in particular, she manages the Early Care and Education Funders Collaborative. We're going to be talking about that today. And in this role, she works very closely with the collaborative and its grantee partners to enhance the quality, the capacity, and the accessibility of early care and education across the Washington region. She hails from Winston-Salem, North Carolina, and her passion for education policy and advocacy was shaped by her experiences growing up in marginalized communities and attending underfunded schools. Her work has influenced policy and decision-making already in areas including special education services, early care and education site openings, and college readiness programs. So across the whole gamut for students of color. In her free time, she enjoys gardening, supporting women as a birth doula. Abriana, I did not know that about you. That is that is like a whole job. So good for you for finding time for that. Babies don't exactly come when you want them to. And watching YouTube. So super happy to have you here today with us. Next up, we have the fantastic Chika Onwuvuche. And she manages our Young Women's Initiative at the Women's Foundation. So we're kind of moving up a little bit from early childhood across our birth to boardroom spectrum of a woman's life. In this role, Chika empowers young women and gender expansive youth of color to become change agents through the Rockstar Fund and regional advocacy efforts. Before joining the Women's Foundation, she coordinated youth-led initiatives focused on systems change and racial equity. She has a lot of experience in working with young people. And she was analyzing how agencies, policies, and institutions impact the communities that they serve. Her passion for engaging those most affected as decision makers drives her commitment to advancing policies and practices that invest in women, girls, and gender expansive people of color. In her free time, Chika enjoys walking, reading, and jamming to global hits. She may be walking and jamming at the same time with her AirPods on. You might see her. We're so glad you're here with us today, Chika. And finally, we have Dr. Tamara Wilds Lawson, with whom I have had the pleasure of working closely this last 2 years. She is the president and the CEO of the Washington Area Women's Foundation. We are incredibly lucky to have her. She's joined the foundation in 2023, and she has been instrumental in shaping and evolving our strategic direction since then, and using her expertise to advance our mission and deepen our impact. She's had the privilege of doing purpose-driven work throughout her career, which in the last 15 years included leadership roles at Act Blue, Washington National Philanthropies, and Posse DC. She's a proud native Washingtonian, and Tamara enjoys traveling with her family and taking a walk with her friends. So welcome, Tamara. So I'm going to dive into our questions here. And as Sarah said, if you have questions on your mind about the Washington Area Women's Foundation, our programs that you have already or that you come to as we talk, please put them in the chat or in the Q&A, and we will get to that open dialogue. But I'm going to start actually just generally. And really, for all of you, as you look at the situation for women and girls in our region, what do you think the most pressing issues are? I mean, there's a long list, but if you have to think of what rises to the top, what is most critical now? And actually, I'll start with Chika. Let's start with you and thinking about especially the young folk in our region.
Lucky me. Hey y'all, Chika here. Thank you, Victoria, for that wonderful introduction. I think so I have a unique lens in that my lens is very youth focused, right? And so I'll let Abriana and Tamara talk about it, what it looks like holistically. But I'm fortunate enough to work from and learn from the young people that we work with regularly, right? And the beauty of some of the programming that we do, particularly with funding the DC Girls Coalition, a collaboration of organizations that do and center young people in their advocacy efforts, but also in their direct service efforts. And it is youth-led. One of the things they have done as stellar programming every summer is a healing circle. And that is in a direct response to the mental health crisis that is happening specifically for Black and brown girls. And that, I mean, it's an experience that we're all seeing and feeling the impacts of, but as a result of the higher suicide rates, the higher depression rates, the higher anxiety rates, that is one of the more prevalent issues that they are tackling. And so in a way, our grantee partners have named this as an issue area and are doing things directly to combat that, the impact of what that looks like, right? So the healing circles with the DC Girls Coalition, but more recently, we just funded the community youth advance, right? And they were tasked with finding an issue area as well in Prince George's County region. And the group of girls came together, talked about what issues were impacting them. And they also named mental health, right? And drug abuse and substance abuse, but as a way to cope with the mental health impacts that they have, right? And so our role in listening and actually learning from our community partners has allowed us to think through what and how the ways that mental health is impacting us, specifically the young people. So I think healing circles are a great solution in combating that. I will also name youth homelessness as a really large issue. I mean, we just had a wonderful Ask Her with Christy Matthews from the DC Girls Coalition, Aaron Wheeler from Smile, a local organization in the DC area. But recognizing that young people are not only experiencing the housing crisis the way adults do in our community, right? We know that rental prices are going up, you know, the interest rates. Yes, they cut maybe a 0.5 percentage point, but that doesn't allow all of us to access that space. But young people are being impacted by that, right? They're sleeping on couches. They don't have spaces to go. And so what does it look like to actually commit to those issue areas? And I think our grantee partners have named some of those issue areas as an issue to combat. I will also make a plug that the Rockstar Fund in all its beauty is not issue focused, right? It's not issue specific beyond being a young person's initiative. And so the Rockstar Fund runs the gamut of addressing issues that our young people are experiencing, whether it's a lack of a creative space in the child welfare system or creating representation in the music industry. Like those issues, there are so many issues. And because we understand that intersectionality exists, right? Intersecting identities, intersecting experiences, they understand it as well and are committed to the solutions around that. And so I think mental health, I think homelessness, and I mean, the issue areas that, you know, we address as a foundation are also pretty prevalent, but I'm going to let Tamara and Abriana take it away from there.
The only thing I will add to that exquisite answer is income inequality and gender-based violence, and our Stand Together Fund, which has now sunsetted. Chika led those grant-making efforts, and we saw an uptick in that violence during the pandemic, and the fund was a direct response to that. And, you know, Chika just named the intersectionality of all of this, and if Abriana wants to chime in, the connection between everything that Chika shared and how difficult it is for folks to afford childcare at a time when people are coming back to the office, and you know, jobs are the growth in the workforce means that people have to figure out what to do with their kids. And I want to take a point of personal privilege, Victoria, just to thank you for being here today, and thank you for being a wonderful board member. For those of you who have joined us today, Victoria shows up in spaces like this. She's at events. She's, you know, has provided some really invaluable counsel. She's the kind of leader you want on a board. So we're really grateful to you for your leadership and partnership.
Thank you so much, Tamara. It really, I mean, for me, like, you know, global giving works on every cause, right? And that's super important to me because lifting up the whole sector is kind of my passion. But my heart is very focused on women's issues and women's rights, particularly my home, right? I feel like all of us, no matter what we do as a job or where we're working and sitting, like, you gotta be engaged in your own community, because that's where you are. That's where your home is. So this gives me the opportunity to do that. Well, Abriana, do you want to dive in with your perspective and where you sit on the programs on like the toughest issues facing women and girls right now, and how the Washington Area Women's Foundation plays a role in helping?
Sure. I think that Chika and Tamara did a great job addressing some of the main category issues that we see that are prevalent not only in the Washington region, but also just kind of like nationally. But I think just to drive everything home, when we talk about women and girls, and we talk about these categories of issues, one of the things that we don't really name is that this is an issue with supporting women holistically. So in an essence, when a woman goes out and is, you know, working in early care and education, and we see that there's an issue with the workforce, as Tamara named, then that's in her workspace. And then coming home, we see that there's issue with quality access to, you know, quality education. That's another subset of like issues that are impacting, you know, womanhood. And then, of course, we see this in our youth, even from a young age. So one of the things that I just want to name is that we do a great job with identifying the categories and the subset of issues that women and girls face. But what does it mean that when they are facing these issues in their home environment, in their work environment, in their private environments, that we look to shape our support for them to be more holistic?
Sorry, it took me a second to get off mute here. I really appreciate you raising that point, because it brings me back to the Washington Area Women's Foundation, like, again, our approach to looking from birth to the boardroom, because there is like this totality of a woman's life, and we see these issues connect with one another. Like, the issues for birth and early childcare directly impact the adult woman, right? Who's working and trying to get jobs and being in the boardroom and affecting the decisions and the policies that are being made around all of these other issues. There's a continuum. And I'm really excited that we as an organization are thinking about our programming really holistically. I think it reflects that. But let's dive into the early child care piece, Abriana. If we could stay with you for just a minute and like zoom in on that exact place. Why is it critical to fund this area? The Washington Area Women's Foundation has been in this space for a long time, so maybe you can tell us a little bit about that and tell us why. Why are we sticking with this core programmatic area?
Yes, and thank you so much, Victoria. I didn't give my thanks for your warm welcome as well, and just thank you for leading this conversation today. But yes, we have been doing early care and education work since 2008. So we are going into our 16th year of funding early care and education. And this work and this intentional funding really stemmed from a research study that identified exactly what we just spoke about, which is the issues that are impacting women are impacting them in their home as well as in the workforce. But during this time, we identified that starting with early care and education would be a great kind of like initiation to the work of the Women's Foundation when it comes to our early care and education portfolio. And so we really started broad with this elaborate mission to close the gap in readiness. And so when you start so broad and you start working with community, you start working with organizations who are doing this work and giving you feedback as to why this step needs to come before this step, and we can't do this action before we talk to these people, then you really are given the opportunity to hone in on and be influenced by the people who are directly on the ground doing this work. So over the course of the years, we have kind of like narrowed our approach and our priorities to be more driven towards the advocacy that comes with ensuring that the workforce is sustainable. So that looks like equitable pay, that people have access to quality education. So looking at childcare subsidies and who are able to utilize that, and where are our quality early care and education centers around the district, and looking at areas that we don't see as many of those childcare centers and asking questions about why. So that's just kind of broad, how we got into this work. But one of the things that I really want to highlight today is just about the care economy as a whole. So the care economy is this like umbrella that, early care and education fits into. But as we know, my mother is a part of the care economy. I'm sure we all have somebody who is working to fulfill the needs of others. And we're able to see just firsthand how that sector is primarily led by women of color, how it's severely underpaid, and how we are kind of leading or leaning on the backs of these individuals. And historically, we've seen that the people who we need the most in this care sector are often underpaid. They're often immigrants, and they often just don't have the access to the resources that they need. And so one of the things that we've been able to hone in on with our early care and education work is, centering the care economy as a sector that deserves to be promoted, as a sector that deserves to have highlighted the early care and education entrepreneurs calling them what they are. You know, these are women who own their own childcare center or their own cleaning business. They're entrepreneur, they're business leaders. So really being able to define members of our care economy and uplift them in this work. So all in all, I think that I've said a lot as to why this means a lot to me, why it's meant a lot to the organization. But I think funding this initiative not only looks at the care economy, but it also bridges some of those gaps that we see within the sector.
Yeah, I think it always disappoints and saddens me to see how underfunded this work is. You know, hospice nurses, childcare workers, people in retirement homes, people who are cleaning and cooking, and as you put it, the people who are taking care of almost everybody, touching everyone's lives, and like as a society, it's just not valued in income in the way it should be. It's just frustrating. So I'm glad we're working on that. Tamara, can you talk about, so this shift to doing more and more advocacy in this space is really interesting, right? Because I think a lot of funders are like, oh, advocacy, I don't know. Like, you know, there's a hesitancy. And yet the Washington Area Women's Foundation realized that to really make an impact in this, you know, we had to do advocacy, and it kind of speaks to our role as an intermediary. Like, tell me a little bit about how we went into kind of advocacy policy, and how being an intermediary brings something, you know, of its own to that work.
When I came to the foundation about a year and a half ago, there was a lot of discussion about how the pandemic kind of robbed us of an opportunity to do what we had been doing prior to that awful time for our nation and for the region. And, you know, ECEFC, the collaborative, has now been around for 16 years. And, you know, Abriana will be able to tell you one of the things that it has done best is to advocate in the early care space. And we've been able to do that with a pretty small team. Abriana has showed up at community meetings and forums and, you know, testified before the city council. So for us, with our mean and lean team, it means that our wonderful program officers are going beyond the typical site visits and are an ear for this issue in all kinds of spaces. Chika, I don't think, mentioned that in some of the forums she talked about, she's there. And so we have an ear there. We use our voice in spaces across the country. Abriana was in Chicago within the last 6 months and was at a table of other stakeholders and funders talking about early care work. So what I appreciate about the way that the foundation has done it coming out of the pandemic is we've been very strategic and surgical in terms of where we use our voice. We have an eye towards being able to do more of that and kind of get back up to the level of advocacy where we were before the pandemic. But you know, one of the many things that I have learned from both Abriana and Chika over the last year and a half is the importance of saying yes when our grantee partners ask us to show up, to amplify the work that they're doing, which is another way that we center the important work of our grantee partners. They know best. They are the experts. And so I'm excited for a future in which the foundation can do more of that, but we are just getting to a point, as you well know, Victoria, where we have really built out and made a more comprehensive programmatic grant-making portfolio. And so I would say within the next 6 months to a year, those who watch the foundation closely will be able to see even more of the Washington Area Women's Foundation voice out there among issues. But I'm a big believer in smart growth. And I said we have 2 program officers, not 4 or 6. So within the confines of what they can do, and we're already doing we're already modeling and I think doing more than what traditional grant making organizations do. And I'll just end by saying we, as an intermediary, are funded by some really generous foundations. And they have said that they want to see us kind of return to a space where they hear our voice more. So we want to be responsive to them as well. And I don't know, Abriana or Chika, if you'd have anything to add to that.
I'll just add one thing. I think that was very plainly stated. I do think as an intermediary, one of our roles is to alleviate some of the burden of the grassroots organizations that we support, right? And so Tamara talked a little bit about, our grantee partners asking us to fill in the space and the gaps in that advocacy space, but not only in the traditional advocacy, I think in the policy development, but within the funder space as well, right? Victoria, you know this, the funding space nationally, but also regionally is pretty limited, right? I think people are restructuring the way they think about philanthropic dollars, and our grantee partners are being impacted by that severely, right? And we are, as an intermediary, are also being impacted by that, right? And so what are ways that we can also advocate in our funder spaces to talk about the issues and the impact of this on our grantee partners is very key in ensuring that they thrive, right? Ensuring that the Black Women's Leadership Report doesn't go, it's not in vain. Like, we are continuously committed to saying that, and also actively working to pursue that advocacy for our grantee partners as well.
I love that because, you're right. I mean, 1.8% of all funding goes to women and girls. That is shocking and shameful. I don't know. Last I looked, there's a lot of women and girls and around, and we got to work on that. And so advocating to funders, right, is a part of that advocacy. And Tamara, I loved you saying what you've learned from Abriana and Chika. I think that just capsulizes your leadership style right there, and also how the Washington Area Women's Foundation learns from its grantees, right? I've heard you all mention that so far in this webinar, and that learning shapes what we advocate for. It shapes what we're funding. Let's talk about young women, Chika. If we could stay on you for a minute, because I bet you have learned a lot from the young women, the rock stars that you're working with. And it's a really unique program. So just share that with us and tell us what makes it so special.
Yeah. I'll start off by saying I'm so grateful to be in community with such dynamic young people. That is by far, I love working with these people as well on the call, but I really, really love working with young people. They're so exuberant, so full of life, and so solution oriented. Like, if we just sat and had conversations with young people, I'm almost positive we would find solutions to all the problems that exist in the world today. So for those of you all who don't know, the Rockstar Fund is our youth participatory grant making program, right? It's where we engage young people as basically philanthropists, right, as funders. So we, as I mentioned, we work with the DC Girls Coalition. They are youth-led. And in addition to setting an advocacy agenda, they help to select our rock stars that we work with, specifically in DC. And so the Rockstar Fund is a $2,000 micro grant that we provide to young people, young girls, women, and gender expansive youth of color in DC primarily, but we just expanded into the Prince George's County, Maryland area this year. So very excited about that. And so the young people from the DC Girls Coalition select our DC rock stars, age 12 to 24. And they are embarking on so many different types of issues. And I think the beauty of that is learning about the different ways that young people want to engage in their own entrepreneurship, engage in their own problem solving. And so they select a program or they select a project and they work on that, right? And our role as employees, I guess, at the Washington Area Women's Foundation, my role specifically is to assist with them implementing that project, both in DC and in Prince George's County. And in turn, we learn from them what issues that young people are saying they're seeing in their community. For example, there is a young person that was selected this year who is in the music industry, and she wants to work on creating representation for women, women of color specifically as audio engineers, right? And so she has all this equipment that she's carrying to the different libraries, and I'm going there and I'm like, you know, on the switchboard. So like, it's also an opportunity for me to learn about the different ways that people are wanting to solve problems that they would like to see, right? So we also have young people who, I think I mentioned this earlier, a young person who wants to implement a creative art program for young people involved in the child welfare system, because she was involved in the child welfare system and she was so she was impacted as a result of that and found beauty in arts during that time in her life, right? And so a lot of times the young people are wanting to replicate things in their lives that were really beneficial for them, and explore that and expand that to other youth within their community. And so since 2017, we've had over, I would say, 45 or so rock stars. We've given away over $90,000 in DC and now in Prince George's County. We're hoping to expand, right? And so I think that's where engagement, that's where that learning process comes from. And so every year there's an opportunity for us to engage more young people. And not only do we engage the ones that we work with directly, but you know, many of the programs also impact other youth as well, right? And so the idea is that they get to see themselves in some of this work, and they get to see themselves as solutions to some of the problems that they experience and that their community experiences as well. And so that's, you know, that's a little bit about our youth participatory grant making program. We are one of the very few, I think, in the nation that does it the way we do it. But we're so grateful to have this program as a staple, I think, as one of the programs and issue areas that we work on.
Yeah, you know, so many funders talk about participatory grant making, trust-based, blah, 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 you know, micro grants, but like, we're actually doing it, right? And it doesn't have to, you know, have a complicated framework and everything else. I mean, you've got all the right elements there. And I loved you talking about your role in assisting the rock stars with their projects, because, you know, Washington Area Women's Foundation is so much more than just a grant maker. You know, there's that assistance, that care, that mentorship, that amplification, all of those other things that you and Abriana are doing every day, and that's what makes the difference in the impact, actually, and makes it so deep and real. So very cool. It's one of my favorite programs. That made you think of something. Say it.
Yeah, I did. One thing I also don't want to discount, because this is also really important. So the young people also meet as cohorts, right? Pretty regularly. And one thing that we try to do is also have women of color business owners and entrepreneurs actually speak to the rock stars and talk about their experiences. And I think while a new addition, a very integral addition to the program, because they love actually talking to folks like you know, women of color business owners that have been doing this work and talk about their challenges, but also lean on each other to have conversations about what they're seeing in that space as well. I think creating space for young people to be themselves, but also ask those really like important questions for their development, and to allow for like peer mentorship, but also mentorship. I think it's called vertical mentorship as well, is something that, you know, it's wonderful to just witness and see. And sometimes that happens organically with them just having conversations with themselves. But I will say it is, you know, it is very impactful. It is just powerful just being in a space with young women and gender expansive youth of color from this region, and seeing the type of change that they would like to see in their community, and actually just doing something about it. I think it's powerful to be able to resource that, right?
Well, and that kind of mentorship is such an opportunity for the people who come do it, right? Because we're all in the moment that we're in, our lives feel overwhelming, we're struggling, we feel like we have so much to learn. But when you step back, especially as you do get on in age, you're like, oh, I actually have learned some stuff, right? I actually do know a little bit more than I knew at 16 or 18 or 20. So it's like such a gift to give someone that moment of like, oh, I've got something to share. And so like, yeah, if there's anyone on this webinar who's thinking, I could do that, I have something to say, get in touch with us, because we're always looking for people, especially from, I mean, as Chika just talked about, these young women are doing all kinds of things, right? Audio engineers, it's not one thing that they're into. And so the more people with different kinds of experience they get exposed to, the better even. Well, I want to move up our spectrum from birth to boardroom here, and let's talk about boardroom. Tamara, let's talk about leadership and Black women leaders and the groundbreaking report. I've sent this to people all over the country, by the way. It's like of interest way more beyond just Washington, D.C., but our report last year called Thrive as They Lead, addressing the infrastructure to support Black women leaders in the DC metro area and nonprofit sector, because it is hard to be a nonprofit leader, but whew, it is even harder at times to be a woman of color trying to lead a nonprofit. So why now? Why did we put out this report? Tell me more.
So the report was born out of a conversation among leaders about 2 years ago now, where they were just in an informal discussion and talking about what at the time just felt like a disturbing trend of Black women leaders either leaving or being forced out of their roles. And so folks in that conversation were just kind of ticking off these examples. And as a result of that one conversation and curiosity, really, the decision to probe deeper and to figure out if this was in fact a trend, and if it was a trend that suggested there was a crisis. And so that small group enlisted the support and expertise of KDF Strategies, who began doing research that really centered the voices and experiences of Black women and Black gender expansive leaders in the nonprofit sector. And by the time I got to the foundation, this group, along with KDF Strategies, had almost completed the qualitative research that makes up the report. And so that's kind of the origin story. And once I was in seat with my agreement and blessing, the decision was made for that project to be housed here. And it has been such a privilege to get in at a time right before the research was complete and be able to be a part of the creation of the report, which has been focused regionally, Victoria, but has been resonant and relevant nationally and across sectors. And it's always important for me when we talk about the report and we talk about, some of the recommendations that we've leaned in since, to say, if you've read the report, you'll note that there wasn't really new information being provided. It was that there was an open conversation about it, right? The quiet part, the experiences of Black women leaders for decades was being we were shining a light on what has been internalized, whispered about. And that level of acknowledgement and validation has been extremely valuable for women, for all kinds of folks, but particularly women of color, who have said, I had that exact experience, and you'll never know how much it meant to me to read through that and just feel like I'm not alone. And I've also said, when talking about the report, it's been great to be a source of validation. And it's also been heartbreaking to hear so many stories. In some ways, I think the initial group of leaders who came together, would have been somewhat happier if the research suggested that initial conversation was off base, but it really wasn't. And the response, as I mentioned, suggests that this is a pervasive issue that crosses sectors. And so the report, again, has been so resonant, and the recommendations that we asked these leaders for have been our focus ever since. And we did some focus groups after the report was released with the initial subset, and heard from them that they wanted in-person convenings to really have a public conversation, right? An opportunity to reckon with some of the things that were named in the report. They talked about wanting there to be a focus on board governance and how boards can better support leaders and how leaders can understand the relationship between boards and their leadership better. They talked about, bold ideas, including reimagining sabbaticals. They talked about direct grant support for some of the, because it was pretty generationally diverse, Victoria. So some of the leaders said, it's really helpful coming in to an organization and right away demonstrating to the board and the community of supporters that there is confidence in my leadership by receiving a grant, right? And then we had folks at the opposite end of the spectrum saying, it would be great to have a legacy grant, right? So that the stamp of approval on the leadership that I've provided for this organization that I am offboarding would be phenomenal, and then set my successor up for success. And then the last piece, and it's interesting, it kind of dovetails with what Chika discussed about the healing circles for young people. There was also a call for healing spaces and safe spaces, whether that is, a traditional retreat space or an opportunity to just come together in a cohort with other leaders to both share and problem solve and learn about what's working. But in any event, having a space that is their own. So those were the things that were named. I'm so proud of the in-person convening that we did in the summer, which we were able to check that first thing off the list for now, because we want that to be an ongoing occurrence. And we are in the middle. We have released the RFP for facilitators for a board training series that we want to roll out. Our intention is to roll that out at the top of 2025. Which is approaching much faster than I think any of us would like. I cannot believe that it's October tomorrow. And then we have an eye towards and are aggressively fundraising for some of those bolder ideas that I spoke about. What does it look like for us to help underwrite or support retreat spaces that are already happening? What does it look like for us to be able to give direct grants? What does it look like for us to fund sabbaticals so that they are disattached or unattached from an organization, because that can make a difference. The expectations that organizations have of leaders when they provide the sabbatical versus an independent sabbatical process. All of those ideas require resources. And so we're raising money for all of that. And I love that the legacy of the report continues. It's not just something that will be circulated and then eventually put up on a shelf, but it's a living document through these recommendations, which we heard loud and clear that these leaders were brave enough to share with us.
And that always doesn't happen with reports. Reports and research can serve their own purpose and like bringing light to an issue and elevating an issue. But I always get frustrated with that. Like they're like, I want to know what can we do? What's the action, right? What's practical out of this? All the things that you named are so practical. And
Thank
so
you, Victoria.
specific.
And I'm just going to interject for a second, because I realize I don't talk about some of the little things that we like. It was imperative that the work that was already being done in this space that a lot of people didn't know about, that we've also shed light on that and have been connecting with folks, right? Like we have a resource guide on our website that lists and names everything from articles and books that have been written to retreat spaces to coaches. And so we want to be additive, not duplicative.
Yeah. Well, and again, those resources that you're naming, I'm sure have resonance across the country. I mean, this is again a place where Washington Area Women's Foundation is kind of providing things for women leaders all over the place. And so it's super powerful. We're gonna get to the last, actually the first part, right? Birth to Boardroom. I'm gonna circle us back into the beginning, actually. And Chika, tell us a little bit about kind of future programs and what do we mean by the birth part? What is the Washington Area Women's Foundation dreaming about and thinking about and plotting and planning there on maternal health?
Great question. And this is a newer, I would say a newer initiative. I'm gonna actually ask Tamara to fill in any of the gaps that I don't have. And so one of the tasks, I think one of the ways that we don't want to be duplicative and more additive is actually in this birth equity and maternal health space. And so earlier this year, you talked a lot about reports. I mean, you just talked about reports and actually what is the action as a result of that. Earlier this year, I would say a couple months ago, actually, we just completed a landscape analysis of what the birth equity experiences are for folks in DC County region, right? So it was important for us not only to assess the experiences of folks who were given birth, but also who are the actors, right? Who are the people within this ecosystem of birth equity? And what are their experiences, right? And so actually Boldly Go Philanthropy is an entity that helped to commission or produce that landscape analysis. And that required several conversations over the course of several months with folks that own their own practices, folks in the healthcare space, folks that worked in community-based organizations. And the question simply was, what are your experiences within the maternal health and birth equity space? And I'm sure most of you are aware about the maternal health crisis that is happening specifically for Black women within the region. And we wanted to get a better understanding about how that experience is shaped by folks that live within this region. And so there were a couple differences that we saw with folks that lived in the DC area versus the folks that lived in the Prince George's County region, right? DC has an abundance of resources. I would say a lot of resources. Maybe abundance is not the word I want to use. We have an abundance of experiences, an abundance of internal resources. But I would say while we have an abundance or lots of resources, they're not as accessible, right? Specifically for our folks in the Ward 7 and 8. And so very much so assessing what those experiences are something that we went through, as opposed to the folks in Prince George's County, right? In a lot of ways, I think we are continuously learning about the experiences of folks in Prince George's County, and there's always often, I think, a perspective of it being the wealthiest county for Black folks, especially, well, one of the wealthiest counties for Black folks, right? But what people don't understand is the pockets of marginalization that people who have a lower socioeconomic status experience. And that does translate into things like not only education, but also that birth equity space as well. And there is not an abundance of resources in Prince George's County. In fact, people are driving miles and miles and miles to get the resources that they need to have safe deliveries or to even talk to their own doctors about the experiences that they have. And so all of these things inform the way that we want to look at birth equity and the way that we want to think through maternal health, and supporting and strengthening that workforce space, especially because, I mean, not only do we have a resident doula on our staff who, you know, does this work very regularly, but we know the needs of Black women, particularly in those spaces, are often unheard, right? And so what does it look like to support the workers that are advocating for Black women in these very, very high stress situations, whether that's while folks are giving birth or after they're giving birth and thinking about their mental health as well. And so I think it is very holistic, and we're thinking through it very holistically and wanting to fill in the gaps. And so ways that we're doing that now is thinking through who are those active players who are doing things that maybe aren't funded in the way that they should be, thinking through who is doing that work and addressing burnout as an experience that lots of birth workers have within this region, especially because of the administrative burden that some of these like very small business owners have within this space. So we're thinking through the different issue areas, and again, trying to fill in the gaps in a way that makes the most sense for, the folks that we serve and the community that we love, that are having these babies and that are wanting to have babies and have that joy, but unfortunately are impacted negatively because of the different systems that come into play. And so I know I said a whole heck of a lot. I'm going to invite Tamara and Abriana actually to fill in the gaps for anything that I missed in terms of.
Just super quick, and thank you for all of that, Chika. We are excited to focus some on mental health, both in terms of the burnout of the practitioners that Chika mentioned and the birthing folks, right? And that dovetails into what the social determinants of health are, and making sure that there is a holistic picture of what it means to stand in the gap and care for birthing folks prior to birth, that birth process, during and after. And we have a particular interest in looking at what's happening after. From everything from the mental health piece to access to nutritional foods, et cetera. And then, Abriana is continuing to inspire us to stay focused on what strengthening and diversifying the birth workforce looks like. And so those are the three places that we're leaning in as we look to pilot grant making next year.
That's awesome. I mean, I think you can hear, like, as we've talked about our existing programs and how much they've been designed, like, by the community and for the community and through listening and I can hear that same approach being taken with the birth equity work here. And like, this is the very beginning of a journey. And I have no doubt the program was going to be incredibly thoughtful as it unrolls and will evolve, right, to meet the needs of the grantees in the community. We have 9 more minutes here, and I'll probably talk for at least a minute at the end. And so I want to switch gears just a little bit. I know everyone who's listening has a better sense of you all as professionals and experts. You're all brilliant. You're bringing so much expertise to the table, but like, this is a chance for them to hear a little bit about you as people too. And so I'd love to, and like, Abriana, you can choose. I mean, I'd love to ask you more about being a doula, because we've just been talking about birth and maternal health and all of that. But I'd love to hear kind of like how you connect to the Women's Foundation's programs as people, or the challenges that women and girls are facing in this region. And just share a little bit about that personal connection. Abriana, do you want to kick us off?
Yeah, I can jump in. I share the same sentiments as Chika in being so inspired by the work of our grantee partners. Each year, Early Care and Education, we provide general operating dollars to about 10 organizations that are primarily led by women of color who are entrepreneurs. And so in having one-on-one conversations about funding for their programs specifically, I've learned a lot about them as entrepreneurs and the different ins and outs and nuances of what it means to continue to work in this space, even when it feels like daunting. And so I think that it just has been a full circle moment for me, because I have always embraced and loved birth, and I've always had an end goal of where I saw myself in that space. But it oftentimes felt like it was kind of like sideline or a hobby. And so I joined the foundation about 2.5-ish years ago. And, just in doing this work and being a part of the research under Tamara's leadership and, talking with Chika about the entrepreneurs that she works with. And then in my experience with our grantee partners, it just feels like a merging of passions. And so I think in real time, we're able to see how the Women's Foundation is really supporting women of girls in color, not only our grantee partners, but staff as well. And I think this is one of the first spaces where I've just been able to lift up and have conversation about like what I'm deeply passionate about. But I've been in the birth space since about 2019 officially, started practicing in New York. At the time lived there, and have since supported birth in DC as well as North Carolina. And actually through also this work, Chika sent out a quick plug one day about one of our grantee partners who wasn't a grantee partner at the time, but has since become Mama Toto Village. They are well known in the birth equity space, in the birth work space, but they were actually doing trainings for lactation specialists. And so again, when we talk about, you know, filling the gap for women holistically and being able to support them on a spectrum, that was just like an honest next step for me. So I would say, you know, all in all, it's been so good to have my passion fueled or like my hobby fueled in my professional space, and just being a part of like a philanthropic community in the DC area that just sees you as a multitude of just being. So that's just my little tidbit.
Awesome. Talk about bringing your whole self to work and being holistic. That's incredible. Chika, Tamara, personal connection?
Yeah, I mean, I love being a resource. I've always wanted to be a resource. My background is actually in social work. This is my first philanthropy job, and I'm so lucky enough that this is where the philanthropy job kind of came from. Just being mission aligned is so important to me. I've always been fortunate enough to be in those spaces, and to carry it on and do this work in this space is really important. Abriana talked a lot about the grantee partners, and how that connects to like just that passion in her work personally. I'm really also inspired by working with the team that I have, quite frankly. The philanthropy space, I talked about it a little bit earlier today, but it's getting a little weird in terms of what the funding space and what the makeup is, and our commitment to racial equity, you know, 1 year and then maybe not so much, I guess. And so I think that being in this space with people who understand what it means not only to be an advocate for your grantee partners, but be an advocate for yourself is really, really important to me, right? And so I'm thinking through ways that we can also transform the way we think about philanthropy is really important to me. And so having decision makers who are also experiencing these things that they're making decisions around impact their lives, but also impact policy is very important to me. So the fact that we center that, the fact that that is what we do day in and day out, like that is a blessing. And so grateful for this team, for this work, and for our grantee partners, and to be able to live out your passion regularly. I mean, a lot of people aren't, so yeah.
I love that. From the first minute I got into philanthropy, I wanted to change it too. So I'm right there with you. Tamara, you got a minute. You got give us something about who you are inside and outside this job.
So I've just been very, very fortunate that servant leadership and mission focused work has been a part of my entire professional trajectory. And the older I get, the more grateful I am. And I realized how much privilege there is in that. And I'll say that at a certain age, which I feel I have reached, I am so excited about the spectrum of support that we are providing, because I have lived into every piece now of what we're talking about. You know, I had a complication during my pregnancy, and, you know, was at death's door. I experienced how difficult it is to seek care for your child when you work outside of the home. I was a young person in this region and understand how important mentors are, and exposure to what's possible is. It's much easier to be something if you can see it. It's not impossible, but much easier. And then I've been in a leadership space for a while, and felt a kinship with the women who were a part of the report. So the servant leadership that's been a thread throughout my career connects directly with the work that we're doing here at the Foundation From Birth to the Boardroom.
Thank you so much. I think it's, I've gotten to know you all a little bit as people as well as professionals. So I think it's great for you to give a glimpse to everyone who's with us today on this. Thank you for sharing all about your work. It's hard to step out for a minute and step, but I hope it's been enjoyable for you. It's been such a treat for me. Before we close, I want to invite everyone who's listening to continue to support this important work by attending the Women's Foundation annual Stand Together reception at the Women's Museum. Like what better place to be on October 17th, coming up really soon. As Tamara said, 2025 is around the corner. October 17th is like tomorrow. And this is going to be an amazing opportunity to celebrate and advance our work, to foster a nurturing environment that invests in and champions women and girls in our region. We have 2 Visionary Award honorees, Angela Franco, the president and CEO of the Montgomery County Chamber of Commerce, and Daryl McKissack, the founder, chairwoman, and CEO of McKissack & McKissack. So it's going to be an amazing night, y'all. And there's going to be hobo bags for anybody who's been to our old luncheons. So there's a chance you might come away with a hobo bag, but you're definitely going to come away inspired and just really delighted and energized by an evening ahead. So there are more information on our website, as there are about our programs and about everything else we've been discussing today. So thank you all. Happy Monday.
Thanks, Victoria. Thanks, Chika. Thanks, Abriana.
Thank you. Have a great Monday.
Bye.